Hello and welcome to Health 2020. I'm Dr. Sello Mukdaung. Now, South Africa is one of the countries with the highest burdens of TB in the world. It kills more people than any other infectious disease, including HIV and COVID-19. Now, between 5 and 15% of people infected with TB get active disease. Now, because the disease remains inactive in most people, they're unaware that they're infected. So today we discuss everything you need to know about TB with a TB expert in studio, and I'm going to discuss what you need to know about TB in general and what COVID-19 pandemic means for people with TB. Now, we earlier asked Pindile Mieki, who lives with TB, to share her experience with us.
Kwathi nothi uphela inyanga indaqala ndasola ndathi no man ngeke ngikhohlele kangaka kwabe ndizixelela ukuthi since emsebenzini kurenew kusetyenzwa maybe yi-dust ndaye ekliniki ndabaxelela basesendinenyanga bangandijiki bathi ndize ndiphinde ndibuye ndaphinda ndahlala yaphela inyanga ndisoloko ndikhohlela nje ndiqhubeka ndisebenza after kwenzekelo ndabe ndabuyela ekliniki abayibona bandithumela kwi-x-ray ndaya e-first lungane e-first ndandithola i-x-ray ndabuyela back up ekliniki e-8 lapho babotshe bona ukuthi ke ndine-TB ubaya khona kwami ke-TB bahlala nami phansi bandithetha nami ukuthi ke i-TB i-dangerous kuzofuneka ndilandelele imithetho yale nto endinayo ngoku ndiyamkele ngoba i-TB i-dangerous. Ukuqala kwami i-medication ndiqala ndiyisebenzisa i-medication yami azange ndilale ebusuku ndandinamaphupha nje abed and ndithi xa ndiwaselilela amaphilisi akhona ndilunywe ndirhawuzelela umzimba lo wonke inoba ithathe isikhathi esingakanani 2 weeks. After 2 weeks hayi ndizidlele nje kakuhle i-medication yami ndayidla ndimane ndisiya ekliniki ndiyothatha babe ndipha amapilisi eviki. I-medication ndiyisele i-6 months bendiyisele ekuseni nalate xa ndibuyela ekliniki after i-6 months leyo babe ndibekela idate andidi bendiba nama-dates okubuyela ndabuyela bathi mandenze isikhohlela bayositshekisha ndaphinda ndabekela idate yokubuyela ndabuyela bayandixelela ukuthi ke ayisendirayithi bandixelela ukuthi sendirayithi uba ke bathi bandingumuntu ophuza utywala mnendilimit utywala ndiphuze kandibhini manje life yami ishapu kuba ndikwazile ukuzinakekela ndenze the way abangitshela ngakhona odoctor.
The support that we give to the people, we work closely to our healthcare workers who visits the clients at home. Remember, stigma takes place because of lack of information, take place because of the fear that is associated to that particular illness. And the stigma when it comes to TB has always been there, and it's worrying that it's not getting better because, I mean, we've been living with TB for more than 30 years. At this point in time, people should be familiar, but then they're not. The fear is real. So the programs that we have information, we do have information sessions. We have our social auxiliary workers visiting people who are on TB medication to check if they've got proper support in place, who do they live with, so that we can empower the household as well. And to an extent that we can even take some members of the household for training, for testing to check if they've also been infected.
All right, that's Ndubim Vinjala there from TB HIV Care based in Cape Town. Now, to unpack all we need to know about this condition, it's a great pleasure to welcome our guest, Dr. Xavier Padanilam, who's a Chief Medical Officer at Sizwe Tropical Diseases Hospital, and he's also lecturer at Wits University. Dr. Padanilam, welcome to Health 2020.
Thank you for having me.
All right, so we've been talking obviously about TB, as we heard. We played a few clips on TB. Let's just help our viewers here. What are we talking about? What is TB?
TB is an infectious disease which is caused by a bacteria called Mycobacterium tuberculosis. Mm-hmm. So what happens with TB is these infectious particles, they hang in the air. So when you breathe in, these particles go into your lung commonly, right, and then cause TB. And these particles come to the air because somebody infected with TB is either coughing or spreading the TB into the air.
Okay, so primarily it gets into the
lungs.
into the lungs and
Yeah, but lungs is not the only organ.
Right.
Any part of the body can be affected by TB.
all right. Well, talk about any part of the body and
Yeah.
the lung and so on. Are there typical signs and symptoms?
Yeah.
Yeah.
When we talk about the signs and symptoms of TB, we normally talk about TB of the lungs. So the common symptoms are fever, chronic cough for more than 2 weeks, night sweats, weight loss, and tiredness. So these are the main symptoms of TB.
Right.
So if the TB affects some other part of the body, some of the symptoms might be still there,
Right.
but the cough is mainly specific for lung TB.
Right, right.
Yep.
So then we've spoken a bit about obviously
Yeah.
the signs and symptoms. Just briefly tell us about how we diagnose this condition
Okay.
of TB. Yeah.
When it comes to diagnosis, there's a few things which we need to look at. The first thing is, as the lady was talking in the clip, the issue is about your health-seeking behavior.
Yeah.
As soon as you pick up any of these symptoms,
Yeah.
you need to go to a clinic,
Yeah.
the nurse practitioner or the doctor, and tell the doctor or the nurse,
Yeah.
look, I got these symptoms, fever, cough, whatever. It could be TB. So they need to go to the doctor or the healthcare worker as soon as possible.
Right.
That's one of the main things. And from the healthcare professional side, they need to keep a high index of suspicion.
Right.
Anything to do with the lungs, you need to exclude TB.
Right. Because it's one of the
It's
commonest conditions anyway.
Conditions, yes.
So what is then the clinical course of events? You know, from the minute somebody gets infected,
Yes.
right through, with or without treatment.
Yeah. If you're not taking treatment, the TB is in the lungs. Now it can go to other parts of the body. It can go to the lymph nodes. Then it can cause problems in the lungs. It can cause severe damage to the lungs. Or it can go to other organs in the body, like your spleen, liver, kidneys. So any part of the body can be affected if you're not taking treatment. But if you take treatment as soon as possible, as I said, early diagnosis, early initiation of treatment, these two are very core issues.
Right.
You go to the doctor, diagnose TB, and then start treatment immediately. So the recommendation is to possibly start treatment within 5 days. Once you start taking treatment, the drugs is going to work on the mycobacterium, the bug which is causing TB.
All right.
And they try to contain the infection. But remember, the treatment is a long 6 months duration.
We're going to talk more about
Yes.
treatment later
Okay.
on. But let's just get back to the issue of symptoms. You know, we live
Okay.
under the current circumstances
Yes.
of, you know, the COVID-19
Yes.
pandemic. And having gone through some of those symptoms, there's some sort of similarities between
Yes.
COVID-19 and TB.
Yes.
What are the main differences?
As you said, there's a few differences are there. The main difference is that TB is like a late onset disease. It doesn't happen overnight. It takes a few days or a few months or a few weeks sometimes to get to the symptoms of TB, whereas a COVID, you probably need to have acute onset perception.
Right.
It might happen within 3-4 days
Right.
after you got infected. The other thing which you need to remember, there are some specific symptoms which is related to COVID, which is like your loss of taste, loss of smell, and other things.
Yeah.
But a lot of symptoms can be similar between TB and COVID.
Like cough,
Like
you know.
cough, your fever,
Yeah.
your sweating, or
Right.
the tiredness,
Right.
all those things.
Right. So let's talk then about, you know,
Yeah.
transmission. We know that,
Yes.
you know, we know what causes TB, as you said.
Yes.
What are the risk factors for transmission and how is this bug transmitted? We've learned all about how COVID-19 gets transmitted.
Yes.
What about TB?
What happens with TB is once somebody is infected with TB and that person is coughing, for example, they got TB of the lungs, these infective particles come to the air and they hang in the air for hours. So they hang in there, and when somebody else comes inside that same space, they breathe in those particles and goes to the lungs. So to prevent those things happening, first of all, from the person who is infected with TB, that person have to be on treatment.
All right, okay.
Early
We're gonna talk-
diagnosis, put
Yeah.
treatment.
All right.
For the person who is breathing in the TB things,
Yeah.
you need to look like ventilation, avoid crowded spaces.
All right. We're gonna. I'll tell you what. Let's
Okay.
let's hold it there because I want us to talk about prevention.
Okay.
just after the break. Okay, time for a quick break. When we come back, we'll learn more about TB prevention, treatment, and of course, answer some of your pressing questions. Right, so our cameraman met with a few people who had some questions on tuberculosis.
Bengathanda ukubuza ukuthi yini TB resistance?
I-TB ngifuna ukuqonda into obana ifumana njani.
I-TB uyakhona na ukuba ube nayo xa uhlala nomuntu onayo.
Very, very important questions there. And let's speak to our guest and, get some responses to some of those questions. Dr. Paranilam, so maybe let's start with the first one.
Yeah.
Interesting question around what is drug-resistant TB?
Yes. Drug-resistant TB means, some of the drugs which normally works for sensitive TB does not work for you anymore. That means the bacteria has become resistant to some drugs. So when it comes to MDR TB, we're talking about the two core drugs which has become resistant. Now the TB has become difficult. So it's difficult to treat MDR TB. It might need a longer duration of treatment, and the success is not so good as compared to the sensitive TB. So the drugs which are effective for sensitive TB, two of them has become resistant now. That's MDR TB.
Okay. So the other two questions really talk around,
Yeah.
the risk of transmission.
Yeah.
Can you get TB if someone you're living with also has TB?
Absolutely.
Yeah.
If someone who is living in your own household has got TB, you have a chance of getting TB. But then remember, if that person is on treatment, your chances are very nil. But if that person is not on treatment, the particles are going to come out. And if you live in a space with poor ventilation, the chances of you getting TB is very high.
Okay.
But I would also like to mention here, some populations, certain categories of people are more prone to get TB, like children below 5 years, HIV positive individuals, elderly population. They're all prone to get, they're more at risk of getting TB if they live next to an infected person.
Talk about HIV before. I know we have a few questions that we need to go to now, but let's stick on the question of HIV. Surely you see quite a lot of conditions occurring at the same time with TB, like HIV, for instance. Just take us through that.
Okay. There are certain clinical conditions which makes you prone to get TB. HIV in our situation is number one. Diabetes is another condition.
Yeah.
The third condition which we might find is silicosis, mine workers who are working underground exposed to silica dust.
Yeah.
And there are certain other things which might make you prone to get TB, like alcoholism and substance abuse. It's a problem. And the third one is, situations like undernourishment. If you're not getting enough food, if you don't live a good lifestyle, and you're too stressful, all these conditions impair with your immunity.
Right.
Your fight against TB is reduced, so you're prone to get those kind of infections.
What about the link then between COVID-19 and TB? I'm sure you deal with such cases a lot.
Of course. When it comes to COVID-19, TB patients are at high risk of having a bad outcome, because TB, it involves the lungs, it might cause damage to the lungs. And if COVID also involves your lung, then the problem is, aggravated. So for patients who are TB patients, in order to prevent COVID getting infected, they're getting infected with COVID, they need to take all precautions which are recommended, like wear a mask all the time, keep social distancing, avoid parties like funerals or birthday parties or weddings or crowded places, do hand washing, all the precautions which are supposed to happen in preventing COVID should be taken care of. And don't stop treatment, continue with the treatment.
Right. Very, very important messages
crucial.
there. All right. We do have some questions that we'd like to get through, and let's see. The first one is from Modise, who says, someone I know has been coughing from April 2020. He's even lost weight. He has had more than 3 bottles of cough syrup and not getting well. And the second one is from Sonia from Western Cape, says, my baby is 6 months old. How can I tell if she has TB? Two very interesting questions as well. The first one there about, having gone through 6 bottles.
Since April, having had cough.
Yeah.
So anything with more than 2 weeks of cough, we need to suspect TB.
Right.
In an HIV positive individual, any cough we need to worry about, whether it's 2 weeks or 1 week or 1 day,
Yeah.
we should be worried about TB. So in this case, they have to go to the clinician
Right.
or the clinic immediately, as soon as possible,
Right.
and check for TB.
All right.
So
That's the
this-
operative
yes.
word there, as soon as possible or
Absolutely. Yes.
immediately.
Yes.
Second one is quite interesting as well, in a sense. It asks the question, how do we see TB in babies?
Okay, it's a very good question. The thing which we need to look at first is, as the baby has been exposed to TB,
Right.
did the mother had TB, anybody else in the family had TB? It's very difficult to diagnose TB in children. So we need to go for different testing procedures. But the main thing we need to worry about is the baby not gaining weight? Is the baby tired all the time? Is there failure to thrive? The baby is not active as before.
Right.
If any of these things are happening, take the baby to the clinic or the doctor. Then there are certain tests, like your Manto test, which might give you some indication whether the baby has got TB infection, active disease.
Right.
But the best possible solution here is to take the baby to an experienced
All right.
clinician.
Okay. Let's see if we have some more questions. And this one, Anonymous, says, does smoking in front of a baby give the baby a chance of getting TB? Very good question there.
Smoking is an independent risk factor.
Right.
Without any of the other things, diabetes, HIV, if you're a smoker, you got 4 times more chance of getting TB.
Yeah. Not just TB, but all other conditions.
It doesn't matter whether you are the active TB or it's a passive smoking. Somebody else in the family is smoking, and you are exposed to that, the smoke.
Great
So
stuff.
the baby is definitely at risk of having TB.
All right. Let's see if we can squeeze in a lot more questions, as many as possible. Stella says, my son is 16 and is not getting any better even though he's taking TB medication. Why? And what else can we do? Aha. So perhaps let's talk treatment first, because the
Yes,
question is
yes,
around,
yes,
when do the symptoms resolve, after taking treatment?
Okay. Usually with sensitive TB, we say we should have some improvement in the symptom by the end of 2 weeks or end of a month. But MDR TB, if it is resistant TB, it might take longer.
Yeah.
But if that person is not getting better, we need to review the whole process. We need to review the diagnosis. We need to look at the dosage. Is he taking adequate dose for his weight?
Yeah.
Is he taking all the drugs? Is he sticking with adherence? If he's taking it on a daily basis, TB is Monday to Sunday. You have to take treatment every day.
Right.
So a lot of things we need to look at it.
Yeah.
If not getting better, we need to go further investigation like chest X-ray, repeat the diagnostic testing and everything, and rule
I'll
out
tell you what.
MDR TB.
I know that we still have a few more questions, but we do have a caller on the line. I'd like us to take this call now, if we can, please. I think, obviously there is some. Hello? Can you hear us? Hello? Is that Mrs. Flatella?
Hello.
Hello, ma'am.
Yes.
Welcome to Health 2020. Do you have a question for us? Ungathatha nesiXhosa if you want.
Yeah, hello. Ndinombuzo, ndicela ukuqonda into yokuba ukuba umntana ufumanise ukuba une-TB, ne?
Yeah.
Lo mntana ke ngoku ubesesibhedlele wabuya ene-TB, kodwa ke ngoku uqala abanye abantwana apha esikolweni. Ingaba aba bantwana basafe kangakanani na ekosulelekeni kule TB lo mntana aye wafunyaniswa enayo? Ingaba basafe nabona?
Okay, Mrs. Flatella, thank you so much for that important question. She's a teacher. She's worried that one of the children in class has been diagnosed with TB. Is there a danger that this child will infect others?
The first thing I want to know, I'm hoping that the child is on TB treatment.
Right.
If the child is on TB treatment, after 2 weeks, the chances of getting infected from this child is far, far less.
Yeah.
So, but then the key importance here is, as I said before, the child should continue with the treatment and finish the course of treatment. If you're worried about any of the other child, we need to check those children for TB.
Yeah. Dr. Paranile, I so wish that we had more time, but unfortunately, that's all the time we have for you. And thank you so much for your time and insight into this.
Thank you very much.
All right, time for a quick break. When we come back, we now wrap up and leave you with some important messages coming out of the show. Please stay with us. Welcome back. Now, here are these key messages we'd like to leave you with. First one, on TB, we know that TB is a very common lung disease and may have similar symptoms as COVID-19, as we took you through. And the important message from the slide is that tuberculosis is preventable and treatable. Now, we went through some of the similarities in symptoms between TB and COVID-19, and just to make the point that, there are certain symptoms that may be common to both, just like, cough, chest pain, weight, fatigue, and fever. If you have any of these, the important thing is to rather seek treatment or at least consult with your doctor as soon as possible so that you get diagnosed early. Now, what do you do during this time if you have TB? And in fact, even if you don't have TB, stay at home, wash your hands frequently or sanitize them with either, sanitizer if you do have, or wash them with soap. Wear a mask at all times if you're out in public, and keep a safe social distance, as we say. Now remember, resistance is also important, and to avoid this, make sure that you take your medication as prescribed, and this means that taking all tablets that are prescribed on a daily basis, and that you complete the entire course, which may take minimum 6 months. Okay, that brings us to the end of our show today, and thank you so much for watching this important show and for all your questions and the call, of course. And next week, we're discussing heart attack. If you have any questions relating to heart attacks, please send these via SMS, WhatsApp, Twitter, Instagram, or Facebook as displayed on your screen right now. And until then, salang hantle.